Good morning, and thank you for joining us for All Things Heart. I'm Alexis Del Cid. Right now, we're working hard on bringing you some incredible new episodes for Season 6, which begins this fall. Until then, we will air Encore presentations every Thursday at 8 a.m. right here. So sit back, relax, and enjoy this Encore presentation of All Things Heart. How one man's skin cancer traveled to his heart years after he was first diagnosed. On today's All Things Heart, the treatment and how he's doing today.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Kyle Mead could barely walk across the room in the spring of 2018. His symptoms were unsettling. He went to the emergency department at another hospital several times. Every time he left with a different diagnosis for his pain, until he finally came here to the University of Kansas Health System, where doctors finally tied his chest pain to a skin cancer diagnosis nearly 18 years earlier.
My son, he came like 6 weeks early, almost killed the wife when she had him. And then my dad died. I found out I had cancer, and my wife was in the hospital 62 days on bed rest before she had my daughter 6 weeks early. So it was really crazy 4 years.
By the end of 2002, Kyle Mead was ready for a new year. His son and newborn daughter were happy and healthy, and so was Kyle after a bout with skin cancer in 2001.
They just cut it out and removed my lymph nodes at that time that drained from that area of my back, and everything seemed good.
And it was good for nearly 18 years. Then in the spring of 2018, a persistent cough, fatigue, shortness of breath, and chest pain sent Kyle to a nearby emergency room several times.
I'd been awakened from sleep. I thought I was having a heart attack. That sent me to the hospital, and they let me out after a night, and I went back to work.
Each trip to the emergency room, Kyle was given the all clear. He was told he had acid reflux on one occasion, given pain medicine for his chest pain on another. Once they diagnosed him as essentially tired and winded from being out of shape. Not long after his last ER trip, Kyle collapsed in front of his mother.
And my mom had already said something about, hey, let's go to KU. So I ended up going to KU emergency that night. It was like July 29th. Within like 5 hours, KU figured out that there was a tumor on my heart.
Kyle said it was the last thing he expected, even with his history of skin cancer.
I knew how terrible I felt at that point. It was super bad. I could barely walk across the room. So that's when I was kind of freaked out.
A biopsy confirmed Kyle's melanoma had metastasized to his heart, something so rare doctors had little information available on treatment, prognosis, or survival. Kyle prayed he'd be around long enough to get his kids through college.
Dr. Doolittle said that information's going to be out there in, 5 or 10 years from now, and they're going to be reading about you.
A team of doctors got to work on how to attack Kyle's cancer. Surgery was out of the question because the tumor was wrapped around 2 ventricles on his heart. Radiation of the heart wasn't an option either. Then doctors at the cancer center discovered Kyle's melanoma had a mutation.
So the prognosis at first wasn't very good, but once they found out I had that mutation, literally, the doctor brought the pills over on a Sunday and had me start on them.
Today, and for the foreseeable future, Kyle remains on his targeted therapy prescription of 12 pills a day. He feels better. The tumor no longer shows up on scans, and he credits his doctors for giving him this extra time with his family.
Hearing the stories, and then once you've been through it, it's like you see the ads of, wish I would have gone there first or whatever. It's all true. Literally, when I think back to everything you hear about it, it's all true. When I was in there were so many different people. You know, I can't even keep them separate, but there are literally like 5 teams of doctors coming in every day, checking on their little part of the puzzle. And just more minds. It's amazing.
We are so pleased to have Kyle joining us today in studio, along with his oncologist, Dr. Gary Doolittle, and thoracic surgeon, Dr. Trip Zorn. Thank you all for making time to be here.
Absolutely. It's a pleasure.
Kyle, how are you feeling today? Sitting
Feeling
here,
good. Feeling good.
seeing your doctors for not for an appointment. Must be great.
Exactly.
That's right.
How old were you when you were first diagnosed with skin cancer?
It was 01, so I was 34.
34.
Yeah.
And what kind was it?
It was melanoma. Yeah, so
And-
I had a mole on my back.
And did you find it? How was it discovered?
I was in a wave pool, and the mole on my back started bleeding into the water, and
So you knew.
yeah, we knew it was something.
And then we want to fast forward now to 2018. Can you describe the symptoms you were having that brought you to the ER?
Just a slow progression of fatigue, and I had a low-grade cough for, like a couple months.
Right.
And it was just, I think everybody has a baseline, and I was going down a different path.
You knew something wasn't right.
Yeah, I knew something wasn't right.
You were a dad to 2 little kids at the time?
2 little kids, yeah.
That must have been so stressful.
Yeah, there was a lot going on
And
at that time.
Yes, well, you really had been through the ringer.
Yeah.
Let's face it, you had a lot, and you were ready for
Yeah.
a fresh start. And you had one for a little bit once you beat the skin cancer.
I had scans for like a decade after
Right.
after that, and it was all clear.
So Dr. Doolittle, he's given the all clear by other doctors. How is it then that this somehow makes its way to his heart? How does that happen?
Right. Melanoma is a little different type of cancer in that the majority of patients, when they recur within 3 or 4 years of the initial diagnosis. So the fact that Kyle went to 2018, 14, 15 years later is unusual, but it's also kind of characteristic of melanoma in that you can see these late recurrences. We think it's probably your own immune system that was keeping things at bay and holding things back, but at some point the melanoma breaks through. Melanoma travels through the bloodstream or through the lymphatics or the alternative fluid that travels through the body, and it spreads that way. So it's any number of ways that it could wind up there. I think the thing that's so unusual is the gap between his diagnosis and then when it recurred.
It seems like that would be a real mind trick because you're finally feeling safe after feeling like I hear a lot of patients say they feel like their body betrayed them and they got something that wasn't expected, and then you're in the clear for so long.
But the good part about that, there's always a spin, because they didn't have this medicine back then.
Right.
So if it wouldn't have come back so much later,
You'd have been in trouble.
yeah, I'd have been in trouble.
I want to take a look at a couple of the scans that we have of Kyle's heart. And Dr. Zorn, I want to bring you in here. What are we seeing here?
So what you see, the darkest part of that image in the middle towards the screen right a little bit.
Like the dark gray blob?
The biggest dark gray blob is the mass. So and when we first got involved, we didn't know what it was. It had been tapped a couple of times with needle drainage or a pericardiocentesis, but no cells had shown up on the fluid, and we didn't have a diagnosis. And so that tumor or mass encased the left ventricle and the left atrium. It compressed the airway to his left lung. It was also encasing the pulmonary artery, the big blood vessel that goes to the left lung.
Oh my gosh.
And there was some question about it even encroaching on the aorta. So it was a very large mass, and the dimensions were basically about the size of a softball. So if you were to put it there, it'd be about the size of a softball in your chest.
Bigger than his heart.
It was about the same size as his heart in many ways, yep.
You said pericardium centesis. What is that for our non-medical viewers?
So the heart sits in the middle of the chest, and we typically refer to that as the mediastinum, and the heart is encased in was called the pericardium, which is a lining that basically is a sac that the heart sits in. And it normally has a modest amount of fluid in there, and that's how the heart moves freely without getting restrictions. And so this tumor arose within that space around the pericardium, around the heart, involving it.
When you went in to test it, when you say we put a needle in, what are you just putting a needle straight through into the heart? How are you doing that?
So he had pericardiocentesis, which was actually coming from below, not to go after this tumor. When they had that, they didn't know that there was a tumor in there.
Right.
That was done before the CT scan. When we got the CT scan, we did not believe that sampling it with a needle was safe. We didn't know what it was, but it looked hemorrhagic, and there were necrotic areas of that tumor. And it's so close to vascular structures that we were concerned about putting a needle in. Now, our interventional radiology colleagues and cardiologists have a wealth of experience putting needles in the body in faraway places safely, but there was some current concern. So we didn't actually use a needle. We made a small incision on the front of his chest, went in between his ribs and took out a core sample of the tissue because we needed to, one, it allowed us to be able to control if there was any bleeding, but we wanted to get as good a sample of the tissue as we could so we could get a pathologic diagnosis.
And that's how you got the biopsy on his heart to figure out what it was. And did the cancer metastasize anywhere else in his body, Dr. Doolittle?
Well, it was really, that was the main structure.
That was it. That's bad enough.
Even if it had, even if he had disease elsewhere, this was the thing that got everybody's pulse racing because there's so many vital structures, as Dr. Zorn has just described, and getting that under control quickly was our biggest issue.
Did you see, we're going to get to a second image in a minute, but Kyle, did they come in and put that image up and show you? How did?
When I had the scan, the area where I got the scan, they'd showed me a picture, and kind of looked like a.
What did you think?
I'm glad I'm where I'm at.
Yeah, that must have been frightening. Well, and speaking of where you're at, let's look at this next image. When was this next image taken? What is that?
This is mid-March.
Mid-March, okay. Yeah. And then had you ever seen anything like this, Dr. Zorn?
So we have, but it's not common.
Okay.
And so, tumors around the heart are uncommon.
Okay.
Most of them arise from other areas.
And this was taken this March, just a few monmonths ago?
Yeah, this
so
is
that's
after
all
his
clear.
Therapy, yeah. So this actually looks good. That's a normal looking scan in that area. In fact, I looked through it this morning in prep for this, and there's no evidence of any remnant of disease at all. You can't even tell there was anything there. It looks very normal.
That's no gray mass, feeling good. And are you back to what you remember being healthy before all the trips to the emergency department?
Yeah. I'm back to normal life. So
that's incredible.
Work, everything. There was probably 6 months where I really couldn't work when we started all this process. But
you're back at it.
I'm back at it.
How did you discover that Kyle had a mutation, and what kind of mutation did he have?
Right. So we believe all cancers are probably caused by some kind of genetic change in a cell. And the standard of care in 2024, and even when Kyle was diagnosed in 2018, is to check the tumor cells for specific gene changes called mutations. And it was the standard at that time to look for a specific mutation called BRAF. And about half the people that have skin cancers like Kyle's have this mutation that produces a protein, and there were medicines designed to neutralize that protein, which will stop the growth of the cancer. So we sent his off, and he can tell you his story a little bit more, because we started with immunotherapy, hoping that would get it under control. And it quickly proved unacceptable, and then we switched out to these two pills. But
yeah, the immunotherapy, I read about it a little bit, and literally on the third immunotherapy, there's a side effect of creating diabetes.
Oh man!
And I didn't have it yet. Probably wasn't far from that, but I had that, and then I started getting pneumonia. I had pneumonia like 3 times after treatments.
Is that common?
And actually,
for that to happen?
Really kind of a funny story is when I came in, I told Kristen,
Who's Kristen, your nurse?
She's a nurse practitioner.
Yeah, nurse
practices
practitioner.
with me.
Yeah, I said, I don't feel right, something's wrong. And she checked me, and she said, she came back because they did a scan, and she said, well, good news or bad news? And I said, well, let's do the bad news. He goes, you have pneumonia.
Okay.
This is the second or third time. I'm like, okay. She goes, good news is we don't see the tumor anymore.
Oh. You'll take it.
So I was like, wow.
Oh my gosh.
Yeah.
And so when it comes to the treatment, Dr. Zorn, is there any way you can operate on that? Or did you just know because it was so tight around both ventricles, absolutely impossible?
So there's two kind of pathways here. So tumors of the heart can be operated on, but his anatomy was different. So most tumors that metastasize to the heart that we can operate on the right side of the heart, the right ventricle, the right atrium, those are the ones we can work on. When it goes to the left side of the heart, that is less common, but usually it's further advanced, and the structures are harder to resect the tumor and preserve the structures there. So there are isolated cases that we can do it, but it was pretty clear from the CT scan at the initial that we were going to have to go through too many structures that we couldn't replace to do that.
And then when it came to radiation, is it always not an option when it involves the heart?
Particularly for melanoma, radiation can be very helpful to control symptoms, but it's not really the best way to try to control this disease. It's either immunotherapy or pills called targeted therapy that Kyle wound up on. Those are our first line.
When we talk about the pills, you're still taking 12 pills a day?
Yeah.
And is it something where you're taking them over the course of the day, or in the morning you're like, here we go, taking
12 of them, or 6 of them in the morning, or no, 9 of them in the morning and 3 of them at night.
And are there side effects to the pills?
Not really anymore. I mean, when I first started, I had fevers for probably 6 months, the first 6 months, but after now
Fevers are side effects to the medication?
For the pills in particular, it's not uncommon to have fever, and the thing is, they work so well.
Right.
70% of the patients will have their tumor shrink, so you really want to try to do whatever you can to get those pills on board. Kyle was really good about this because sometimes it can be so bad you just hit the wall and you can't keep going.
Sure.
We will try to come in with antipyretics. That's great for the audience.
What is that?
Tylenol, something to control fever, right?
Right.
So we'll try to come in with that, or sometimes we'll have a little low-dose prednisone to try to get through the side effects. And you were pretty motivated to keep moving with it, and a motivated person will put up with a lot and manage to kind of ride through it until things settled out.
And the fact that you, first of all, you survived everything, and then if anyone at home, think about how bad it feels when you have a fever. Your skin hurts. I'm the biggest baby when I have a fever. That's the one thing that gets most people down and home, and you were just going with fevers for 6 months because you so badly knew you wanted to get through this.
Yeah, I did learn on the fevers, you get the chills.
Yes.
Well, I would bundle up, and that's totally not what you do when you have a really high fever.
Okay, time out. My grandma always bundled me up. That was the cure. You're not supposed to do that?
God, I did that. I literally did that for like 2 or 3 months, and then a really good friend of mine, she said you get in a cool shower, and you take a cool shower, and then you can get back to bed with a sheet on. That's it. You do not bundle up. I mean, I literally used to go in my car and turn the heat on.
Yes.
Which is totally not the right thing to do.
Not what you're supposed to do?
Yeah.
No, I mean, recently,
you have a fever, you need to cool yourself.
I went to sleep with my winter coat on because you have the chills. So Dr. Doolittle said that Dr. Doolittle is going to be reading about you, and patients are going to be reading about you, and researchers for years to come. What is that like?
I hope it's a lot of years to come. So, I mean, it's all good. I mean, I've gotten more than I thought I was going to get, so every day's a good day.
You've gotten a lot, and your scan is fantastic. We love answering viewer questions. We want to answer every one of them. Well, you all are going to answer the questions. Send them to us on YouTube, Facebook, the X platform, the All Things Heart email. You can find all the links. You can connect with us in real time right now on your screen. And let's go some of the community questions that have already been submitted. Lisa has a question for Kyle. Lisa wants to know, you said you wanted to see your kids graduate. How old are your kids now?
So Mason is 24, and Madison's 21.
Nice.
Mason works in town, and Madison's a junior at KU.
Nice. So you've seen your kids graduate and from college soon.
Yeah.
You're going to see.
Totally.
Anne wants to know, Dr. Doolittle, I'll ask you this one. So did Kyle's cancer ever truly go away, or was it always brewing?
Yeah, our feeling is it was being suppressed, right? That it was still present, but being suppressed by his own immune response. And then at some point, for whatever reason, a particular clone or a particular subgroup of cells breaks through
The mutation that you talked about.
Right. We're going to learn so much more about this whole process as we understand the genetics of these cancers. And we know so much more now than we did 10 years ago. And part of what I was trying to say to Kyle when I said people are going to be reading about you is that up until that point, if you got on the internet, a disease like Kyle's, the only thing he would read is, you're not going to survive this. Yeah.
Wow.
And by that point, we were, in the medical community, we were recognizing that people were going to be surviving this, that this is, at least they're going to live a lot longer. I have to admit, even today, after all of these agents, immunotherapy and targeted therapy, when I see somebody go into remission, I kind of get this big rush with that, And like the trainees that are around me, I'm like, yes, remission. And the trainees are looking at me like, you got a little bit of a screw loose that you don't, this is what happens when people get these medicines, but still, when you haven't ever seen that before, and then you practice through a period where these like remarkable agents come to us, it's amazing. It's amazing to see it and be part of it.
Julie wants to know, how long do you think, Dr. Zorn, that tumor was growing?
Well, it's a great question. I think it probably resided in his lymph nodes for a long time, and for whatever reason it got turned on, or his immune system kind of lost control of it. The size that it had to be there at least months. And with his symptoms, it was at least months.
Many months.
How big it was 6 months before he saw us, it's hard to know because we don't have the imaging for it. So
we have a Facebook question coming in. Jeremy Yenser wants to share and then has a question. Jeremy writes, my cousin's husband has a very similar story of starting with skin cancer and then it spread to other areas. Are some cancers just more likely to spread, or is it an inevitability if you let it go too long before it's found? Well, I guess he's asking, are cancers always likely to spread? Is it inevitable?
No, and particularly a lot of this has to do with the stage that you find a cancer when the patient first comes in. I mean, I always like to stress that melanoma is a surgical disease, right? It's not necessarily the disease of the medical oncologist. By the time they come to me, it is spread to the lymph nodes, or it's spread throughout the body. I depend on the Dr. Zorns out there to, remove these cancers when they start, and hopefully at a stage where they won't recur. And in fact, that's what we'd hoped for Kyle. I mean, he had a 14, 15-year remission, and most patients that go that far don't recur. So, no, and it's very much cancer specific, right? And the stage of the cancer, how far along it is when you diagnose this, and the particular type. But I hate to say this as a medical oncologist in front of a surgeon, but the majority of cancers are cured by surgeons, right? Getting into the surgeon's office, or a primary care doc diagnoses it, gets the patient to a surgeon, and then the surgeon removes it. And the hope is that you're removing it at a stage where it won't progress.
Brock wants to know, Kyle, when you were in the ED, before you came here and saw these doctors, was there any scan that could have been done in that emergency department elsewhere that would have detected this heart problem? He came here to finally have someone see it.
Right. So his symptoms, unfortunately, are common to a lot of diseases. So this is what a lot of ERs will see a lot of patients. And the majority of patients coming in with chest pain and shortness of breath and those issues do not have melanoma metastatic to the chest.
On the heart.
In fact, the incidence would be extraordinarily rare. But I do think surely some imaging may have picked it up earlier. That same night they saw him, they probably, depending on how busy in ER, they probably saw several other patients with similar symptoms that did just fine and had some of the things that they were concerned about. So that's the tough part about being an emergency room doctor, is that you don't know the diagnosis when they come in to see you. You have to work through it. and figuring out how much to do.
You're triaging, and you're not going for the highest type of scan. You're trying to figure out immediately what's wrong. Is that
so? I do
accurate?
think, but I do think, what we picked up with CT scan would have been picked up a few weeks or months earlier, depending on the growth of it. So.
Well, thank God he came here. Lori wants to know, Dr. Doolittle, how do you think Kyle's case is going to help other patients in the future?
I just think he's an inspiration. And then not only for other patients, but for all the people that take care of him, right? I mean, when you work with a disease that's never been cured before, and then you start to see the Kyle Meads come through, and I'm going to embarrass you, but Kyle had a lot of dignity through this process. And that's inspiring, and it's inspiring to the medical team, but it's also inspiring to family and friends in the community. So I would want, other patients to know that you can get through this like Kyle did, and he inspires.
That's pretty incredible, and that's absolutely
it's
true.
It's mutual. I like to bring this up, but when I was in the first 14 days in the hospital here. I had a group come in every day, and it was multiple groups of guys coming in and ladies, and a particular intern that followed one of the, I'm not sure what actually department she was in now, but she would come back after she was all done and say, okay, what didn't you understand? And we just kind of went back over everything. And that was a really big deal. It was kind of like a little jump of hope. Mm-hmm. Every time she came in, and again, it was, the doctors come in and you don't really want to ask them a bunch of questions, but you can. But you can.
These guys are great.
But she made it really easy to kind of pump myself up.
As we head towards our final thoughts on this discussion, I want to continue talking to you, Kyle, to start off. You ended that story we ran at the very beginning of this program talking about the collaboration and how good and safe it made you feel. Can you share a little bit more about that collaborative effort?
I mean, it started when the first, I'll say the first hospital I went to, I saw one person. That was it. And when I came here and we got the diagnosis, or we didn't even have the diagnosis, I was just here. Mm-hmm. I think the first 2 or 3 days, I saw like 5 teams of people. Like, I'm not talking like 2 people, I'm talking like several people. And I know it's a teaching hospital and that's how they do it, but the more smart people, I just, in today's world, it seems like everybody's sharing in the medical industry. They're all talking, and I was just a fortunate one to be in the right place at the right time.
The right health system. Not all health systems are like this, with all these experts on board on the same case. Dr. Doolittle, I've got to ask you about melanoma, because this coming Monday is Melanoma Monday, and it's Skin Cancer Awareness Month. What's the most important thing you want to press upon our viewers?
Yeah, I think the most important thing, there's actually a couple. Awareness. I think Kyle already told us, he said, I had a mole and it was bleeding. So a mole that changes, bleeds, or itches really needs to be looked at by a healthcare provider. I think routine skin checks, important part of wellness. Sun protection, right? Yeah. Avoid the sun from 10 to 4 if you can. That's not realistic. We're going to want to be out. I want to be on the lake at 2 o'clock in the afternoon. So sunblock, sun protective clothing, cap, sunglasses. Go enjoy yourself in the sun, but protect yourself from the sun. So, American Academy of Dermatologists is the first Monday in May, Melanoma Monday, so we really talk about that. We also have a 5K, Outpacing Melanoma 5K.
And when's that?
That is next Sunday, the 5th of May. And it's a fundraiser. This is our 13th year, sponsored by the Outpacing Melanoma Foundation. They donate their proceeds to the KU Melanoma program. So anything we can do about melanoma awareness and getting it out there, we really want to do. We really want to help.
Dr. Zorn, can you talk about the collaborative approach? Because this program is all things heart. We have you, a thoracic surgeon, on with our oncologist, Dr. Doolittle. Total collaboration here.
Yeah, so this is a pleasure to talk about, because this is what makes this job much more fun doing this. The spectrum of diseases that we see these days are so much more complex. There's so much of what we practice is not the garden variety cardiac and thoracic surgery. These are incredibly complex patients that far extend my bounds of what I was trained and where I was. And so Dr. Doolittle was very kind, saying that surgeons cure cancer. The surgeon didn't cure this cancer. A surgeon went in and got a biopsy on a piece of tissue, and then the geneticist who helped figure out, the pathway for this and the drugs that were developed, and then the oncologist who put that all together and got the right medicines to his patient. That's how this success story was written. This was not totally about surgery, but that's the cool part about this environment is being able to work with really smart and talented people all across the board. So.
The geneticists are incredible. We actually have a future episode on the geneticists and everything that they can study and discover. We love sharing the incredible work of our entire team here at the health system, how they save lives. We also really like showing you what life looks like for them outside the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, Dr. Doolittle, this is your first Behind the Mask with us. You sent some amazing pictures. Tell us about the pictures you sent.
This is actually close to the coast of Maine. Yeah, this is actually the Redwoods in California. The theme here is travel.
Yes, and the outdoors.
And the outdoors.
And who's this?
This is actually the Tour de France. I went last summer with some friends that are really avid cyclists, and so we were able to see that too. So that was cool.
What's it like watching the Tour de France? You only get a quick second to see them go by.
I know, it really is like that.
So you go all the way to France, and then shoom, there they go?
Yeah, you really have to watch all of it, and then you get about 3 minutes of unbelievable, right?
Yeah.
But it was a lot of fun. It was great to be with the friends we were with. And this is me out in the sun as a melanoma doctor.
But I'm sure you have loads of sunscreen on.
Sunblock, sun protective clothing, sort of, and my wife.
Your beautiful wife.
Yeah.
Is she also a doctor?
She's a nurse practitioner in oncology, actually.
Oh my gosh,
So
is that how you met?
That's how we met.
Very
That's
cool.
how we met.
I love stories like that. It's like Grey's Anatomy, but in real life. Okay, Dr. Zorn,
Not
every
as cool
picture.
Not as cool as Grey's Anatomy.
What are you talking about? Dr. Zorn, you also sent us some outdoor pictures. Where are you? It looks like you like being on the lake or the river.
So that's
or
paddleboarding,
ocean.
yes. So that was, I think those were from a recent trip where I basically went back for my mom's birthday, and along the way, I grew up in Alabama, that's where they are. That's my wife and my two oldest kids in the background there playing golf. So,
Now, is your whole family medicine too?
No. I have a daughter who's a third year in college right now that is thinking about medicine, but everybody else is kind of going their own ways.
Does she want to be a thoracic surgeon?
She does not know what she wants to be yet, so she's trying to figure that out.
That would be so cool. Would you love it if she came here and you?
Well, it is a little bit. Yeah, my dad was a cardiac surgeon too, so it was.
You come from a dynasty of cardiac surgeons.
And we have our cousin. My cousin is here now too. So yeah.
Dr. Tyler Zorn.
You got it.
Yep.
You got it. Yeah.
There's a lot of Zorns here because we're always accidentally emailing or texting one or the other, and you're both T Zorn.
It is mass confusion. Yes, exactly.
You're both awesome. Thank you so much for being here. Thank you, Dr. Doolittle. Kyle, you are an inspiration. This is just a remarkable journey. Thank you.